psychological arousal, fearful anticipation, irritability, sensitivity to noise, restlessness, which we call bechani, poor concentration, and worrying thoughts. Next. Symptoms of autonomic arousal are dry mouth, difficulty in swallowing, epigastric discomfort, frequent or loose motions, and the respiratory ones are constriction in the chest, difficulty in taking breath, heartbeat, being aware of one's heartbeat, palpitations, discomfort in the chest, awareness of missed beats in the heart, and sleep disturbance like insomnia. या नींद नहीं आना. Patient will come and say नींद नहीं आती. Muscle tension like tremor, headache, aching muscles, hyperventilation, dizziness.
I will request that we have difficult words.
Yes.
So we should tell that in Hindi also.
Yes, okay.
So that the students also understand.
You can suggest what
I will also
sure.
wherever
Yeah.
possible.
Hyperventilation, what would you call it? Taking
ज़्यादा
सांस पास. Dizziness, in the extremities, and
Hello,
ma'am. We are unable to see the slides.
He's unable to see the slides. Sorry, can you see?
No, ma'am. We are not able. Still, we are not able to see the slides. Maybe you have to adjust your screen.
Can you see it now?
Some bodies asked.
दिख रहा है?
Yes, sir.
Okay, now we can see.
Okay, thank you. Okay, now we come to classification of anxiety disorders. I have to talk about this because the ICD, International Code of Diseases 10, Chapter 10, classifies anxiety disorders in this way. There are two subgroups of anxiety disorders, phobic anxiety disorder and other anxiety disorders. And generalized anxiety disorder comes in the F41, which is other anxiety disorders. Next. The symptoms of anxiety disorders can occur in any anxiety disorder, but the specific symptoms of generalized anxiety disorder are worry and apprehension. So the patient finds it extremely, these worry and apprehension that the patient experiences are very difficult to control. He has muscle tension like restlessness, trembling, difficulty in relaxing, and headache. There may be autonomic overactivity like sweating, palpitations, dry mouth, epigastric discomfort, and dizziness. And as I mentioned before, sleep disturbance. Other symptoms are depression, obsessions, and depersonalization. Next. This is again a repetition. Just say feeling the heart rate beating fast, fast चलना, बेचैनी, मतलब ध्यान केंद्रित करने में मुश्किल, और difficulty in falling asleep, which is sleep. Now, awareness of the physiological sensations like palpitations and sweating, and the awareness of being nervous and frightened. Anxiety affects thinking, perception, and learning. Therefore, if a student is anxious, he is going to have difficulties in learning. It tends to produce confusion and distortion of perception of time and space and meaning of events. Anxiety has effects on the selectivity of attention. Therefore, anxious people, they are apt to select certain things in the environment, like the negative things, and they overlook others in the effort to prove that they are justified in thinking that this situation is right. So that is a very important thing. It's one of the most common group of psychiatric disorders, and depending on the criteria used, the lifetime prevalence varies from 5.1 to 8.9%. Females are twice as prone to it. Etiology. Generalized anxiety disorder, in a nutshell, appears to be caused by stressors acting on a personality who is predisposed by a combination of genetic and environmental influences in childhood. Next. The stressful events. It often begins in relation to stressful events, and if the events persist, then it becomes chronic. The genetic causes suggest that the anxiety disorders are more frequent amongst the relatives of patients with anxiety disorders. A study using the DSM-2 criteria confirmed that anxiety disorders were more common among the first-degree relatives of probans with generalized anxiety disorder as compared to the controls. Twin studies also confirm that it has a genetic cause, but not totally. There is environmental factors that also play a part. Early experience. Now, early experience of the child is recognized as a cause of anxiety disorder. And Kendler et al. Found that the rate of several psychiatric disorders, not just general anxiety disorder, was greater in women separated from the mother before the age of 17 years. Then there are certain psychoanalytical theories. This suggests that anxiety rises from intra-psychic conflict, means अचेतन मन से ये जो anxiety होती है, and it is when the ego is overwhelmed by excitation from any three sources. One is outside world, some stresses in the outside world, which is realistic anxiety. Then instinctual levels of the id, including love, anger, and sex, and the superego. So these are the psychoanalytical theories. There are certain cognitive behavior theories, that there is conditioning. Conditioning theory suggests there is an inherited predisposition to excessive responsiveness of the autonomic nervous system, together with generalization of responses to neutral stimuli. So that means even something that is we will perceive as okay, they may get very anxious due to it. Cognitive theories propose that generalized anxiety is a result of tendency to worry a lot, unproductively about problems, and focus attention to potentially threatening circumstances. Lastly, personality also has a role. So persons with anxious personality traits are more prone to develop. Neurobiological mechanisms are very complex, and they involve several brain systems and neurotransmitter systems. Sufficient to say there is indirect evidence of increased noradrenergic function in generalized anxiety disorder, but it is not known whether it is primarily the problem with this or it is due to the cognitive reasons. Now, there have been some functional brain studies which suggest there is no difference in blood flow of any part of the brain. So, in a nutshell, this is what the neurobiological mechanisms are. Then another important factor is psychiatric differential diagnosis of anxiety disorder. So anxiety disorders may exist with these disorders. Depressive disorders, because the symptoms, they overlap a lot, but careful mental status examination will distinguish. Schizophrenia, dementia, particularly in the early stages, substance abuse, and physical illnesses like thyrotoxicosis, which is pheochromocytoma, hypoglycemia, and anxiety secondary to physical reasons. Now, coming to treatment of anxiety. In early stages of treatment, simple methods of counseling are helpful. But others who have more severe problems, they may need cognitive behavior therapy or medication. Counseling follows the general lines that there is a clear plan of management agreed with the patient. Explanation and reassurance is very important, explaining about the disease, that the disease is not caused, that is not caused by physical reasons. And you may even give the patient a pamphlet because their concentrations are very poor, so you may give them a pamphlet explaining anxiety. Problem solving. Another important point is caffeine. I don't know, it has been noticed that patients with anxiety are more prone to the anxiogenic effects of caffeine. So we ask them to avoid tea, coffee, and these type of caffeine, these energy drinks also. So then relaxation training can reduce anxiety in less severe disorders. Here I'd like to mention yoga. It offers an effective means in dealing with stress, anxiety, depression, and addictions. It improves sleep pattern and enhances overall well-being and quality of life. And yoga in our country is readily available to us, so we should make use of this as a part of our therapeutic armamentarium. Cognitive behavior therapy again is done by a psychiatrist or psychologist and combines relaxation with cognitive procedures designed to help people to control worrying thoughts. For example, some of the methods used are distraction, like focusing attention away from the distressing thoughts. Secondly, neutralizing the anxious thoughts with a positive one. For example, my heart is beating very fast because I feel anxious, not due to heart disease. So this is how we change the thoughts. And we challenge the maladaptive thoughts. And in between, we keep reassessing. Again, we come to then medication. I won't go much into detail with medication. We should use it selectively. It can bring symptoms under control quickly. Some of the medications used are benzodiazepines, but they have a risk of addiction. Buspirone is another medicine that is less likely to cause dependence. Beta-adrenergic antagonists like Inderal, they can be used for severe palpitation, but under medical supervision because they should be avoided if medically contraindicated. And antidepressants, they act more slowly, but there's no risk of dependence, or that is advantageous in this. I thought it would be important to talk about COVID-19 impact on anxiety. We are living in unprecedented times, and the COVID-19 pandemic has been reported to cause high rates of anxiety, depression, post-traumatic stress disorder, and psychological distress. And the multicentric studies reports are coming in, and I think all the doctors have observed this in their day-to-day practice. So this is something very important. Anxiety has been voted the Children's Word of the Year 2020. Lexicographers of Oxford University Press, they surveyed 8,000 children and they found 1 in 5 chose anxiety as their number one word. These findings, they reveal the psychosocial impact that COVID-19 has had on children. And another thing that all us teachers know, that the last 2 years have been a challenging time for kids and their studies. A lack of attention and involvement in the daily learning process has created a gap in the understanding of basic concepts. And naturally, this learning gap will contribute to anxiety. We can expect it. So, and recognizing the enormous impact that the COVID-19 pandemic has caused on the mental health of the nation, the Honorable Finance Minister has announced the launching of a national tele-mental health program in the 22 budget. And I understand that NIMHANS Bangalore is going to be spearheading this. So now I thought we will look at exam anxiety. So exam anxiety is a very important topic. You see that they have many reasons for exam anxiety. One is fear of failure, self-doubt, poor performance in the past, unpreparedness, whether course nahi hua, hasn't studied the whole year, extreme competition, which is very, we know, may motivate or demotivate, judgment from others and parents, feeling I am not good enough. So I think that for the child, he has to establish what is the cause of the anxiety, whether he is unprepared, whether he is demotivated, severe competition, past history of not doing well, getting scolded by the parents. So that is another very important thing that has to be kept in mind. Have you got the cartoon that we show? So next one. No, the next. Like this one. This one. Yeah. Okay. Okay, fine. So how to deal with exam anxiety? The first thing is be prepared, as the Boy Scouts say. Be prepared. Early preparation decreases the likelihood of anxiety. That's just common sense, actually. Make a study plan and inculcate good study habits. Find out what the course of the study is, what you're going to be examined on, clarify any doubts, plan your studies and break it up in small tasks, take regular short breaks, get a good night's sleep, give yourselves mini rewards when you achieve goals. Focus on your studies and don't let friendships distract you. And here I'll have to mention the social media. The social media is a very distractive thing and children are always on their phone. So this is, I would suggest that for some time when they are studying, they should avoid social media. Take a healthy diet, avoid junk foods, energy drinks like caffeine, drink a lot of water. And very importantly, don't compare yourselves with others. You are unique. For the parents, the parents should try to understand the mood of the child who is studying and help to calm him down. They must try to encourage the child even if he does not meet their expectations. And they should seek help if required. Now, this cartoon is interesting. Prashantji, can you just show this one? Focus maker. See, the day of the exam, no, the next one before that. You see that 4 children at the exam, 2 of them are quite fine. One is quite chilled out. He is prepared. He knows it. One is very happy because he knows he is going to score high marks. And 2 of them are extremely distressed and anxious.